Welcome back to You Asked Doc About Infertility. In this episode, we're discussing how to treat infertility. And here you have a board certified doctor that is explaining your options step by step. In our last video, we covered the most common causes of infertility. If you haven't watched that yet, I recommend checking it out first, and the link is in our description for this video. Today, we're answering the next big question. What can I do about it? From lifestyle changes to advanced treatments like IVF, I'll walk you through your options step by step. Getting evaluated is key. Before any treatment begins, the first step is a full fertility evaluation. For women, this includes hormonal blood testing. Tests like FSH, your LH, AMH, these are all hormones that would need to be evaluated. It's also very important to screen your blood type when we're doing fertility screening. Rubella status, and that's your immune status against rubella infection. Sickle cell screening and other disorders that may be genetic. And again, this is very individualized. So in your fertility evaluation, these are part of preconception screening. STI screening and screening for sexually transmitted infections, can be done at this time as well. Ovulation tracking. This involves monitoring your menstrual cycle to pinpoint the time of ovulation, which is when an ovary will release an egg. This is the most fertile time of the month. Monitoring or ovulation tracking can be done through various methods, including tracking your menstrual cycles, monitoring your cervical mucus, checking your basal body temperature, or using ovulation predictor kits that can be purchased at most local pharmacies. The hormonal blood test that is done as part of your fertility evaluation will also indicate whether you may have ovulation disorders as well too. Part of that testing hormonally would also screening for any thyroid disorders that can contribute to irregular ovulation as well. Pelvic ultrasound is key during the fertility evaluation. And then there's a test called a hysterosalpingogram. We'll shorten that to just say it's an HSG test that's done to check for blocked tubes. For men, the list is short. It's just a semen analysis. And the semen analysis will evaluate the sperm count as well as the quality of the sperm, how the sperm swim, the shape of the sperm, and so forth. All of these tests will help your doctor figure out the root cause and match it with the best treatment plan based on what may be wrong. Medical treatments for women who are dealing with infertility really depends on the issue. For instance, if the issue is with ovulation, there are medications that can help. Clomiphene, which is better known as Clomid, or Letrozole, and one of the brand names for that would be Femara. Oral medications that stimulate your ovaries to release eggs. Injectable gonadotropins or injectable medications for more advanced cases if the oral medications don't work. Conditions like PCOS, thyroid disorders, or elevated prolactin levels known as hyperprolactinemia can be managed with specific medications targeted for these conditions. Surgery may be needed for issues like fibroids, endometriosis, or blocked tubes, and can improve chances naturally or combined with assisted methods. Male fertility treatments, really for men, treatment depends on the underlying cause as well. Hormonal imbalances might need to be treated with medication. Infections might need antibiotics, and simple lifestyle changes, well, simple for some, difficult for others, but lifestyle changes such as quitting smoking, reducing alcohol intake, improving diet, often help with sperm quality for men. I often say to my clients that, a male infertility issue a lot of times can be remedied with very simple lifestyle changes. And in some cases, sperm can be retrieved directly from the testicles for use in IVF. Now, assisted reproductive technology is a form of treatment of infertility, And under this umbrella, it really incorporates IUI, which stands for intrauterine insemination, which involves placing washed sperm directly into the uterus at the time of ovulation. And it's less invasive, pretty well tolerated, and it can be often used in conjunction with the ovulation induction medications, which is the Clomid and the Letrozole. The other form of assisted reproductive technology, or ART, is IVF, which stands for in vitro fertilization. The most well-known option in most instances, right? So the eggs are retrieved, then they're fertilized with the sperm in the lab. That then produces the embryo, which is then transferred into the uterus, and then you proceed with the pregnancy. The success rates are very variable. It depends on your age, your egg quality, and any underlying conditions. There's another procedure that can be used as well with ART, which is ICSI or ICSI, which stands for intracytoplasmic sperm injection. And the most common reason to do an ICSI is because of male factor infertility. They just need one sperm, and that single sperm is injected directly into the egg with that. Donor eggs, donor sperm, or even an embryo adoption can be considered in some cases for couples with poor egg or poor sperm quality. Using a donor can be a life-changing experience in terms of their path to achieving pregnancy. Lifestyle and holistic support must be mentioned in this video as we talk about treatments for infertility. Never underestimate lifestyle. Eat a balanced, whole foods diet, exercise moderately, reduce your stress levels, and get enough sleep when you're trying to get pregnant. Acupuncture, supplements like CoQ10 or myoinositol can be considered. Discuss it with your doctor, of course. Minimizing exposure to plastics and endocrine disruptors may also support fertility, but always talk to your doctor first. I will get into some of these supplements in a video coming up next month, so we can definitely look forward to that. Now, alternatives to manage infertility as well as your support your emotional health is very important as well too, because if your fertility treatments don't work, then that can be a very disarming and emotional process for most couples to endure. So there are still options. There's surrogacy, but you have to be very aware of any boundaries or barriers to surrogacy depending on where you're located, where you live. There are some international fertility clinics that are more versed in the world of surrogacy within legal parameters, but it's still an option. There's a lot of ethics to be considered when you're considering surrogacy, depending on who you select as your surrogate. And again, there are some legal barriers there still that may exist for you. Adoption is another option. And I always advise, if you're considering adoption, even in the process of while you're trying to figure out your infertility, adoption can sometimes take long. There are barriers there as well too, so you can look into the information earlier rather than later. Now, you can also decide to live child-free, which can still be a very fulfilling and empowering choice. Infertility can take a toll emotionally. Therapy and support groups are incredibly valuable. So there's no one-size-fits-all solution, but there are many options, and most people who seek help find a path that works for them. If you found this series helpful, please like, share, and subscribe. Drop your questions in the comments below. We may cover them in a follow-up episode. You're not alone in this journey, and as always, I'm here to answer what you asked Doc. Next month, You Ask Doc About will focus on the world of herbs, supplements, probiotics, and even more. What should you take? What are the trends versus the truths? What do you need to know? So thank you again for your time. Stay blessed. You can also book an online consultation with me for a one-on-one discussion of your specific concerns. Bookings for online consults can be made easily via our website. You'll see all the details below, but visit us at azaleahealthtt.com.
Sorry.